everybody, we're live. Okay, it's Dr. Alex Earl. We're here at Pure Plastic Surgery, and it's Hump Day with Dr. Alex Earl. So welcome everybody to Hump Day. This is the time we get to spend with you guys, and of course we can answer a whole bunch of your questions and go over some plastic surgery topics. And you know that it's great, reliable information because I'm a Duke-trained, double board certified plastic surgeon. I've been doing this for many years. All right, so right before we kind of jump into today's topic here, I do want to go over a few kind of housekeeping things which are very important, okay? So, number one, it is, try to not reschedule the surgery within 30 days, okay? We're not going to be able to do that really for most people unless there is something really, like, truly extraneous circumstance, okay? So no rescheduling within 30 days. All right, before 30 days, it's okay. Also remember that your deposits are refundable, 100% refundable before 30 days. We're pretty much the only practice that does that because we know, sometimes things can change. But once you get within 30 days, okay, the deposit is no longer refundable, and we can't change your date. Okay. Number two. Your clearances. You have to do everything humanly possible to be cleared, okay, by 3 weeks before surgery. All right, we've pushed back our date to when we start contacting people regarding the clearances to 60 days. So we're accepting labs that are within 60 days of your surgery now, okay, because we understand things are, after COVID and everything else, things move a little bit slower, but we have to have everything in by 3 weeks before surgery, okay? If we don't have it in by 3 weeks before surgery, we may be forced to have to cancel the surgery, okay? So we need all your information in, and why is that? Because if anything pops up, say for example the EKG didn't come out completely normal, we need a cardiac clearance, we need to repeat your coags, which is one of the laboratories that we have that determines bleeding rates. Then we have ample time to do that and still get you to your surgery date without having to move anything. Okay, so very important. Get all your clearance materials into us by 3 weeks before surgery. The next thing is your payment. Your payments are due by 2 weeks before surgery. Okay, it cannot be any closer to surgery than that. And the excuse or the saying that, oh, I'm going to wait till I'm fully cleared before a payment is not valid. Okay, especially if you're supposed to have gotten all your stuff in by 3 weeks before surgery. All right, so we need final payments by 2 weeks before surgery, no exceptions, or we'll have to take you off the calendar and put someone else on there. Remember, we have a very long wait list. We have a bunch of people on there. They have their clearances ready, have their payments ready, and they're booked like 3 months out, or in April. I think we're booking to April now, and they want to go now. And so we have to give those people an opportunity. So if you don't have your clearances by 3 weeks, or you don't have your final payments by 2 weeks, then we'll just have to, take you off the schedule and put someone that's been on the wait list into that spot. Okay? All right, everybody. Excellent. So enough about that. Let's talk about today's topic, which is BBL Lingo. That's right. So, a lot, especially, if this is your first time, you've never had surgery before, you've never had a liposuction, etc. There's all these terms that are being thrown out, which can be sometimes quite a bit confusing and difficult to understand if you're not kind of within this kind of the surgery world, and especially this BBL slash liposuction type world. So that's why we have a lot of things that can help. So for example, we have a Facebook kind of community. It's a group called Earl's Pearls. And you can find that there on Facebook. And there you have, we're up to about like 8,700 members or so. It's really quite impressive. And we have, people that are, that have just had surgery, people that have had surgery a year ago, 2 years ago, and then people, of course, that are looking to have surgery in the near future. And the great thing about that is it really forms a community. There's some veterans there that have gone through this. They understand the lingo, they understand the process, and they're incredibly helpful. We really love our pearls on there that kind of help and support each other, and that's really the point of the group, is to have a community feel, to have education, and to know that you're not going through these things alone. And many of the things that you're kind of scared of, or that you're going through, other people have been through them, and they'll give you that support and that education that you need. Okay? So first, when we're talking about BBL lingo, we got to start right from the top. So what does BBL stand for? And of course, BBL stands for Brazilian butt lift, okay? Brazilian butt lift. And why is it called Brazilian butt lift? Because many say that the pioneer of this procedure was a doctor by the name of Ivo Pitangui, who's a very, very well-known, a pioneer actually in plastic surgery, who hails from Brazil. So many people say Ivo Pitangui, he kind of came up with the procedure, and of course it's been, modernized and developed significantly since then, but because of that, it was named the Brazilian butt lift, okay? It's a little bit of a misnomer in the sense that it's not an actual lift, in the sense like, say, for example, a breast lift, because really it's, you're adding volume, you're not necessarily lifting the tissue, so you're not cutting off any excess skin, you're just adding that fat to add volume, and to change the shape. So you're reshaping and adding volume, not necessarily lifting, okay? There are some variations of that. So we have your skinny BBL. So skinny BBL is pretty much similar to your regular BBL, except it's done on a patient whose BMI is lower, typically lower than 24. So that's where the skinny BBL comes in. Of course, you don't have as much fat to work with. You're going for a more kind of a natural or enhanced natural and athletic shapes, and you're not going for like the really kind of drastic or what used to be called vixen type of looks, okay? One of the things that everyone should know is that a BBL, whether it's any of these types of BBL, it always comes as part of the BBL is the liposuction portion of it, which is a lipo 360, meaning it's a lipo of the entire trunk, okay? So abdomen, flanks, waist, and pretty much almost the entire back come as part of your BBL, okay? All right, and then we've actually developed this further right here at Pure Plastic Surgery by yours truly. And here, the only place you can get it is here at Pure. You can get the SO BBL or the South Beach butt lift, okay? And that's something that we've started doing fairly recently, I think less than a year ago now. And so the difference there is that we're minimizing the access points. We're really hiding the access points. We're making it so that when you combine this with a beautiful kind of enhanced natural look or a soft vixen look where all the curves are nice and smooth, you can really make it seem like you've never had anything done at all, and that you're just beautifully naturally enhanced. And all the little incision and port sites are very, very nicely hidden, such that you can hide them even when you're in one of those little tiny bikinis out on the beach in South Beach. And that's why we call that the SO BBL. And even more recently, you guys have probably seen one of our posts and our stories. We've done the SO BBL upgrade, where we've gone ahead and hit the incisions even further. So while we used to have one kind of at the bra line there that was easily hidden within the bra line, what if you wanted to go topless to the beach, right? Then we can't hide that one. So now we've hidden that into a little crease here, kind of, or just in the posterior kind of armpit area. And so that one's completely hidden there. So now you can go to South Beach, and I wouldn't recommend it because it's not legal here in Miami. But if you were to go topless to South Beach, there would be no evidence that you had your Lipo 360 BBL. And that's with the SOBI BBL upgrade. Okay? All right, so that's kind of the beginning. And then you have, many kind of words that come up when people are trying to describe their BBL, what they're looking for, how they want to look, what are their preferences, okay?
Is there a special BMI for the SOBI BBL?
Yeah, that's a great question. So it's not for everyone, that's true. So you do have to be a little bit more in shape, a little bit on the lower BMI side. Typically not a lot of loose or hanging skin. So typically for a patient that's a BMI of 24 or below, relatively good shape, and with good quality skin. Okay, and that's the perfect candidate for the SOBI BBL. And with that, if you wanted to actually, and I didn't add it here, but we should put it down. We can do HD. So HD with the SOBI BBL, and that stands for high definition. So high definition lipo when we're etching out the musculature of the abdomen and we're defining that. So the SO-BBL can many times come with HD, as well as the skinny BBL that can come with HD as well. And again, in order to do that though, the patient has to be in relatively good shape with good skin quality. Okay?
Thank you.
All right, so the next we have kind of, the looks and what the patients are going for in terms of their waist. So a very, very common term, and you've probably heard it out there, is like, I want to be snatched. Okay, I want to have that snatched look. So what does that mean? So snatched refers mostly to the area in the waist where you're trying to make that waist as small as possible. So you're really trying to shrink that waist as much as you can, and when that waist goes, significantly smaller, then people refer to that as being snatched. Okay. Another kind of look, which is a little bit of a softer look in that area, and I think it's actually a beautiful type of look, is what we call the hourglass shape or Coke bottle, Coca-Cola bottle shape. There is not so much about just getting the waist as small as possible, but making sure that as you come in from the flank into the waist and then back out into the hip area, that it's a nice, smooth, kind of beautiful kind of curve there. And that's what we refer to the hourglass shape. That's one of my favorite shapes when I'm talking about the waist area, and that's one of the things that we truly strive for, is for that hourglass shape. Okay. Now, one thing I didn't mention here, which is very often sometimes used in terms of talking to BBL, is a term you call vixen, or that vixen look. So vixen look is when you have a very, very tiny waist with a relatively significantly large hips and buttock and projection. Okay, that's what's typically referred to as a vixen look. It's typically a very exaggerated look, a very kind of surgical type of look. And it's usually nowadays, because we can't and should not place fat into the muscle, it's usually something that we cannot do in one round. Before, it was more likely you can do it in one round because we're putting fat in the muscle, which we all know today to be very, very dangerous. So we don't do that. In fact, we use the ultrasound to make sure we don't do that and keep you guys safe. Okay? So if you're going for a vixen look, sometimes just vixen or video vixen, then typically it's going to require more than one round in order to get that look. And it used to be more popular, I think, a few years ago, not as popular today. Okay? All right, so now that we talked about the waist, as we come down, then the next two terms that come up are lats versus hips. Okay? And it doesn't really have to be either or. I mean, you can have some degree of lats and, of course, some degree of hips. So it's not like, or give me lats or give me hips, and you can't have both. You can definitely combine them. But again, a few years ago, I think lats were more popular. The lats are higher up, so they're kind of higher up here. Again, having significant lats is a more of a surgical look. Okay, so it's a less natural, more of a surgical look. And having big lats was more popular before, but not so much nowadays, as we're going for more kind of the enhanced natural soft vixen look there. And then the hip is a bit lower, so the hip is down here. So the lats are up here, the hip is down here. So you got waist, lats, and then hip. Okay. Let's see if I can kind of draw this here. This would be kind of more lats, and then kind of more that Coke bottle. That's more hips. Okay. So the lats are here. This has less lats and more hips. Okay. So that's what's referred to as lats versus hips. I think overall, having nice round hips in an hourglass shape is a nicer look overall. But we can add a little bit of lats to that if someone wants it. But I think in general, you want to have less lats than hips, because if you have more lats than hips, like that, then we get into shapes that are not really that popular anymore, like this wisdom tooth type of shape, which we'll talk about here in a second. Okay, so you can have you can have both, but definitely you want to do more hips than lats. Okay, in general, you want more hips than lats. Okay, all right. So now that we've established kind of how the front is going to look, okay, and say for example a very typical shape are like, hey, Dr. Earl, I've seen your videos, I've seen your photos. I have a BMI of 24, have good quality skin, I'm in relatively good shape. So I would like to have the Sobe BBL with upgrade HD with an hourglass shape, more hips than lats, okay? And that gives me a lot of information in that one little sentence right there. And so the next thing we gotta talk about is, of course, the buttock itself. All right, so now we've kind of turned around, we're looking at the buttock. What are we going for there? So a lot that gets discussed is that transition from the lower back into the buttock area, okay? That's a very important transition, and one that actually now has 4 kind of varieties to it. So, of course, nobody wants like the flat look, right? Nobody wants like my back just goes into my butt and there's no definition there, right? This is one of the things that we can change drastically. But next, we can talk about the slope all the way down to the shelf, okay? So actually, let me take it backwards a little bit and talk about the shelf. So the shelf look is when you're going from the lower back to the buttock. So now this is a side view. So you're going from the lower back into the buttock, and it's kind of like this very, very kind of like little like table that you can put a little glass on here type of thing. That's a shelf booty. Again, used to be popular later, back in the day, a few years where lats were more popular, vixen looks were more popular, shelf booties were more popular. I don't think it's a great look overall in general, but that's the shelf look there. So basically you go from the lower back, boom, into the buttock in a way that you can literally like kind of place something on top of there, okay? So typically not as popular today to do the shelf. So now we're left with these here. So the slope is quite popular, and that's kind of when you're going from the lower back, okay, and then you're kind of sloping in your buttock, and you have more fullness towards the bottom of the buttock, and that's overall a fairly enhanced natural shape, okay. And then you get into degrees of how much more volume you want in that upper part of the buttock. So if you want just a little bit more volume, then you can call that the Pokey Slope, okay? And that, but not quite a shelf, then you're looking at the slopey shelf, okay? Then you're looking at the slopey shelf there. The slopey shelf, I think, is still okay. That's still a decent look. It's not like completely going out almost in the horizontal direction there, so you still have some gradation to it, which is nice, but definitely some more fullness in that upper pole of the buttock there. That would be the slopey shelf. So typically some patients will come in and nowadays they'll either want a slope or Pokey Slope or slopey shelf. It's rare nowadays that someone wants a full-on shelf. Okay.
We know you do round 2s. Do you ever take round 3s?
I do on a case-by-case basis. Okay, so I do have to go over that patient's information. I have to go over their photos. I have to have a very kind of realistic conversation with them as to what I think they can and cannot do. Because by the time you get to round 3, there's typically a lot of scar tissue, a lot of fibrosis. It's definitely a more challenging surgery. And so we have to have just a very kind of down-to-earth conversation as to what the realistic expectations are going to be. And some of them, if I really think I can't do any significant change, and I may even, end up, hurting the patient, then I'll just refuse the case and say I can't change or do anything there. So it's going to be very much on a case-by-case basis.
What's the lowest BMI that you would work on for a patient?
So, lowest BMI for a BBL, typically, of course, we need some fat to be able to transfer. So usually the lowest BMI is somewhere around 21. Have we done some that are 20? I think we may have done a couple, but it's not very common. So for example, the Sobe or skinny BBL, BMI range is usually 21 to about 24.
Do you usually have to do round 2s on your patients?
I wouldn't say usually, but also at the same time, I would not say that overall it's not like rare or uncommon. Okay, and the reason I say that is that, and that goes back to some of the statistics related to BBL. So once you decide you're going to have a BBL, the statistics overall, okay, all patients, all populations, state that there's about a 6 to 10% revision rate, okay? And there's somewhere around a 15% of patients that want to just go for another round. So if you add those together, you're talking about 20 to 25% of patients who've had a BBL who are go back for a second one, okay? So while it's not the majority of patients, and also not something that I would call unusual, okay? So that's something that you have to understand. It's part of your kind of informed consent and something that you have to kind of internalize as you go to get your BBL. Because I know a lot of patients, they come in and they're like, oh, I'm one and done. I'm never doing this again. And so it's my kind of job to let you know that once you embark on this journey, there's about a 25% chance that you're going to want to do something else, okay?
So if you have a patient that you're consulting with that has unrealistic expectations, do you tell them, or what do you tell them?
I do. Sometimes I think I'm not as kind of like straightforward as I should be. Like I don't like to say something like man, those wish pics are just absolutely ridiculous. There's no way that we can do that, because of course that would hurt a patient's feelings, and that's not what I'm about. So I do try to choose my words, and sometimes I think that it gets lost, but you guys will hear me. If I use the word challenging, okay, that means that most likely the photos that you're showing me are not quite realistic, and that it's going to be very difficult. It's going to be a difficult case, and that your foundation is one that is challenging, that is difficult to try to achieve, some of these shapes with, and that it may take more than one round to get there. Okay, so yes, I never want to hurt anyone's feelings. I want people to feel good about what they're doing, but I do have to make sure that they have realistic expectations. And so one of the key words that I use there is the word challenging. Like, for example, say something like, your foundation is really, really challenging. I'm going to do my best. I understand these are the shapes that you like. I'm not quite sure that we can get there in one round, and it may take more than one round to get you to your goals. Okay, that would be something that I would typically say in that type of conversation.
Not a BBL question, but really quick, do you offer paniculectomy?
Of course, we can do a paniculectomy. So what is that? A lot of patients are probably asking, what is that? So what is that is basically a tummy tuck where we're only doing a skin excision. So we're not moving the belly button. It's usually for a massive weight loss patient. So we're not doing application. We're typically not doing a lot of lipo or anything else. We're just removing the pannus, which is that overhanging skin here. It's called the pannus, and that's all. You're strictly just removing that skin. That's what a paniculectomy is. Okay, and we can do that. But a lot of times, a patient asks for a paniculectomy, and they could really use their muscle repair. So why not just have your tummy tuck? I mean, you're in there anyways. You might as well repair the muscle. Really try to get your belly as flat as possible, and of course, remove all that excess skin. Okay. All right. So we talked about the transition from the lower back into the buttock, and how that has 4 different kind of gradations, all the way from your slope to your shelf. And now we got to talk about kind of the overall shape of the buttock. Okay, so ones that are typically discussed are the bubble, the upside down heart, and the wisdom tooth. Okay, wisdom tooth, I said, nowadays not very popular. That's where you have big lats, so you have a shelf booty. It's a very, very done, very, very surgical look. Doesn't look very natural at all. And that's typically not what people are asking for nowadays. And I totally agree with that. It's not a great look. So we're typically not doing that. Okay?
Have you heard of the Pokey Slope work?
Yeah, that's the one right here.
Oh, okay, got it.
Yeah. So that's kind of the next one up. So you got your slope, then you got your pokey slope, then you have your slopey shelf, which are all, I think, fairly good options depending on what you want. Then you have your full-on shelf, which I don't think is a great option right there. Okay? All right, so you got your bubble and you got your upside down heart. So bubble is kind of exactly that. It's just kind of a rounder shape overall. Okay, so just a very round shape, nice projection, typically combined with a little bit more of something like a slopey shelf type of look, and that's going to be your bubble. And then of course you have your upside down heart, one of the shapes that I'm really known for. I love that shape. I think it's a beautiful, enhanced, natural, soft vixen type of shape, which is your upside down heart shape there. So that's the difference there between your bubble and your upside down heart. When you do a bubble, you have to add a little bit more in those lat areas. to create more of that kind of completely round shape there, round shape or C shape. And then of course when you're doing the upside down heart, you're not putting so much into the lats, you're just concentrating on creating nice beautiful hips in that area. Okay?
After the drains are removed, post BBL Lipo 360,
Yeah.
aside from urine, how else does the body continue to drain?
So yeah, I mean that's exactly. So once the drain is removed, then that fluid gets absorbed. Eventually passes through your lymphatic system and into your urinary system, and then you expel it. So that's really the way it works. If that fails, then that fluid accumulates, and you have what's called a seroma. Okay, so seroma is when fluid just gets basically stuck there. Doesn't get reabsorbed, and of course the drain is out, the wounds are closed, so it has nowhere else to go. And so it's like a little pool of fluid in between the skin and your abdominal wall. And so the way to then we have to physically do something to drain it. And usually that's done with a needle aspiration. We stick a needle into the seroma, we remove the fluid, take the needle out, and then put you in compression to try and prevent the seroma from coming back again.
If a patient comes to you and asks just for fat transfer to the hips, is that considered a BBL?
So technically, yes. So BBL, like I said, it's Lipo 360 plus fat transfer. So if you're asking for it to just go to the hips, then that's fine. We can do that. That's certainly not a problem, but it does fall within the realm of the BBL.
But during BBL, you touch the hips anyways, correct?
Yeah, that's typically part of it. That's why we go into that discussion. So in terms of the hips, it falls within this discussion of like the overall shape of the booty. And so at that time we do talk about the hips. We discuss kind of degrees, like how much hips, how little, etc., etc. The one thing, that's great. I totally forgot. Another term is hip dips. All right, hip dips is a very kind of popular term discussed at the time of the Lipo 360 BBL, and that's where you have the waist, and then you kind of pop out a bit, and then you kind of come in, and then pop out a bit, and you have these little dips in the hip area that need to be filled out. Okay, and so the only way to fill hip dips is with fat transfer. There is no other way to do it. So we always get, sometimes we'll post like a beautiful result, and of course we'll always get some asinine comment where someone is like, "Oh, she should have just worked out." I'm definitely not against working out. I think the best combination is when you do all three, which means nutrition, proper diet, exercise or working out, and surgery. Okay, that's the best of all worlds. But there's no way you cannot work out a hip dip. It's impossible. Actually, if you work out and you work out a lot, you're going to make that hip dip worse. Okay, because the hip dip is basically an indentation in what we call the trochanteric area here, and it's attached, and there's very little fat in between there, and that's what causes the dip. And so the only way to kind of pop it out is to fill it with something, to fill it with volume, and that something, of course, is going to be fat. And there's no way to specifically target and fill an area with exercise, okay? As you exercise and you lose fat, as you become thinner and thinner, you're going to lose even more fat in the area. So when you exercise, you're going to make a hip dip worse. All right? So you got hip dips, you want to fill them out, the only way to do it is with surgery and fat transfer.
All right, your drawings have been great. Somebody's asking, can you draw, what's an example of a pokey slope?
A pokey slope? All right.
Let's see how this looks.
Let's go for it. So pokey slope, right? So you got your slope and your pokey slope and then your slopey shelf. So this is a side view here, okay? So you're coming to the side and you have a that would be kind of your typical, just your regular slope, okay? And then if you're coming out, and then if you pop it out just a little bit more here, okay, that would be then your pokey slope. And then if you're popping it out just a bit more, not quite a shelf, but just a bit more there like that, that would be your slopey shelf, okay?
Mm-hmm.
And then if you really come like almost like horizontal, like this, horizontal, then that's your shelf, okay?
Beautiful.
So those are the different gradations there. You got your slope here, right in between here, you have your pokey slope, then over here is where you have your slopey shelf, and then your shelf back there.
Beautiful, thank you.
All right.
Is it possible to just fill in dimples versus a whole BBL? Is that even a thing?
So yes and no. So a BBL is really what you want it to be, right? There's no cookie cutter type of BBL, especially here at Pure Plastic Surgery. So of course, the patient's wishes and are what we try to strive for. And if someone says, I just want a little bit more in the hips, it's enough to fill the hip dips, and that's it, then we go for that. If someone says, I want to make my hips as wide as possible, of course within reason and making sure that it fits your body, we'll strive for that. And if someone says, I just want to fill these specific areas, we can do that as well. Now, when we're talking about specifically about certain areas in the buttock, remember there may be some other things going on. For example, cellulite, right? So cellulite does cause some indentations, especially if it's moderate to severe cellulite. And a BBL or fat transfer is not the cure for cellulite. Okay, so that's why you gotta send your photos, send your information, let me evaluate you to see what's going to be the best procedure for you. But if you send me an evaluation, you say, all I want to do is fill these little indentations, and I take a look at that, and the reason you have them is because of moderate to severe cellulite, then the treatment's not going to be a BBL. The treatment's going to be something like Quo, which we have here at Pure Plastic Surgery now. So right now we have Quo, which is QWO, okay? Essentially, it's an enzyme that you inject, okay, and it breaks up the fibrous septae, or the little bands that are causing those indentations, allowing then the skin to kind of pop back up and create a smoother contour to the buttock, okay? The cool thing about Quo is that it's basically an office procedure. It's just a little injection there. And it doesn't require any sort of anesthesia. It doesn't require any sort of downtime. So it's really, really awesome, and it works well for moderate to severe cellulite of the buttock. Now, I guess the downside, you can call it a downside, is that it requires 3 treatments, okay? And the treatments have to be spaced out 3 weeks apart, okay? So for our out-of-town patients, it's a little bit more difficult in the sense that they would have to come here at least 3 times, and then, like I said, 3 weeks apart to get their full course. And of course, for our in-town patients, then I highly, highly recommend that. Not a lot of practices are able to do Quo here in South Florida, so we're one of the very few and lucky practices that are able to do that. So I highly recommend that for anyone with moderate to severe cellulite of the buttock.
Is it possible to get an embolism even when only injecting into the fat?
No. So if you're only injecting if you're only injecting into the subcutaneous fat, let me put it that way, into the fat layer between the skin and the muscle, okay? There are no large vessels there. It would be very, very rare to get a fat embolism, okay? I'm not going to say 0% because nothing in medicine is 0%. But what I am going to tell you is that there are no large vessels in that space, okay? And so it would be very, very, very difficult to get a fat embolism. And if you do, it would be like a nano fat embolism, which is not really clinically significant, okay? The large vessels are, within and deep to the muscle, okay? And if you lacerate one of those larger vessels and large amounts of fat get into that vessel, that's when you have the very dangerous, very clinically significant fat embolism that can put you in the hospital or potentially death.
Thank you. All right, I have an interesting question. So you have a patient who wants 3 things in her future. She wants a tummy tuck, a BBL, and a baby. How would you rank those 3?
And a baby?
And a baby.
Oh, okay.
So what's
baby
first?
First.
Baby first,
yes,
okay.
Definitely baby first, okay? Because your body's going to go through a lot of changes with pregnancy, post-pregnancy, breastfeeding, etc., etc. So if you have those things, baby first, then tummy tuck, then BBL.
Beautiful, thank you. So how do you lift the bottom of the buttock if somebody is a little bit older and has sagginess on the bottom of their buttock?
Right, so that's a good question, and it really depends on the degree of skin laxity or how loose the skin is, okay? And so if it's just kind of natural aging, then a lot of times we can do that, make the buttock appear more full and more lifted simply with fat transfer. Now, for some of our massive weight loss patients, sometimes they do have just too much excess skin, and then they have to go for a true butt lift, which is a surgical butt lift, meaning that a lot of that excess skin is removed from the upper buttock, and that of course creates a scar that kind of is in that upper buttock kind of shape there. But that's the only way to really remove all that excess skin and kind of lift everything up in that sense. The downside, of course, is that scar that goes all the way across the back in the upper buttock region.
Thank you. I know you have time for a few more questions. Really quick, is it possible for a patient who's had a BBL in the past for their butt to start to sag?
It's like everybody else, whether you've had one or not.
Okay.
So yeah, we can never defy gravity. We can never defy aging. And so what happens over the course of time is that the skin starts to lose its spring, its elasticity, and starts to kind of stretch out. Gravity, of course, takes force upon that. So yeah, everyone's butt's gonna sag, as they get older. So what are the things that, what can we do to kind of make sure that doesn't, to minimize that risk or make sure it doesn't go too far? Number one is don't go too crazy. Don't ask for super vixen type of looks or butts, because that, once you get older, that's going to be a lot of weight there, a lot of effects on gravity, and you're going to have a lot more sagging as you get older. So that's why our style here is a lot more kind of the enhanced natural soft vixen type of look overall. I think it's a much more lasting look than kind of some of those exaggerated looks there. Okay.
All right, we'll take.
And then just real quick, another thing you can do is of course exercise. So once you've healed from everything, 3 months down the road, squats are actually okay. You should do them. So squats will just enhance everything that we've done. So like I said, surgery is not a substitute for exercise, and exercise is not necessarily a substitute for surgery. The best of all worlds is to have great nutrition, continue to do your exercise, and for that you want to do kind of weights or HIIT type exercises, and for the buttock specifically you want to do squats, and of course your surgical enhancement as well.
Thank you. I know I have to go soon, so we'll just 2 more questions. Is that
Sure.
all right?
All right. Let's do it.
I have a natural pokey slope, but no hips. With a BBL, will that add projection? To my shape so I have more of an hourglass figure?
Yeah, we can certainly do that. So that's one of the powerful things about the BBL. When you combine that lipo with the fat transfer, it's kind of a subtraction addition type effect, and that's why we can alter a shape so drastically with this procedure. And it's one of the things that I love about the procedure, is that you can really taking a decent foundation, you can drastically alter the shape in a way that would never happen with diet and exercise alone. Never happen with diet and exercise alone. And so if you naturally have a shelf, some people have a natural shelf, and you want to create, and from there you want to go to a pokey slope, we can certainly do that. If you're happy with the way it looks up top, and you just want to fill the bottom and round out the hips, we can do that as well. So, like I said, it's not cookie cutter. We go kind of from what you show me, what you like, and we try to achieve that shape as best as we can.
All right, thank you very much. So when your patients come in with their wish picks and asking you what your opinion is, do you give them an opinion on what you think is best? Do you give your patients an opinion on what you think is best for them?
Yeah, I do. So, and let's come back just a little bit. So in terms of your wish picks, the best thing that you can do is to try to choose someone whose before looks very, very similar to yours, okay? That's definitely gonna be much better and more useful. It's not as useful if you just bring, like, say, a photo of a model or an IG model that you really, really like and you really love her shape, okay? But her foundation may be like nowhere kind of near the one that you have, and that's not going to be very helpful, okay? What is helpful is if you have a before and after, and that before looks very similar to you, their foundation is very similar to yours, their age, etc., is very similar to yours, and then, we can have a better round, okay? And so, yeah, picks, examine you, look at your foundation, determine, what is something that we can what is something that is reasonable and that is realistic versus something that is just not.
Thank you very much. One more question: Have you ever had a death?
No. Thank God. Knock on wood here. We do everything that we absolutely can to minimize that risk. Safety is our number one priority here at Pure Plastic Surgery. We are JCO certified. We have multiple safety protocols in place. We use the ultrasound for the fat transfer portion to what we call the danger zone area. We have great anesthetists and just overall a great team. And our pre-op, protocols are very, very strict with multiple layers. And so putting all that together, we try to create the safest environment for our patients possible, and which unfortunately gives good outcomes. Now, having said that, the only way to have a 0% complication rate or or no risk at all is to not do surgery. Okay, so all surgery carries risk, even in the best of hands. Okay, even when we try to do everything that we can for the patient, all surgery carries risk. Our job is not to eliminate risk because we can't do that. Our job is to minimize that risk as much as possible. Okay, and for that reason, that's why we have so many checkpoints. And if a patient fails at any of those checkpoints, and we deem that it's too risky, then we will not proceed with surgery. Okay, and of course we want to catch things early. Okay, but we have multiple kind of checkpoints because, as we know, in everything in life, sometimes the first checkpoint doesn't catch something and the second one might, or the third one might. But whenever we catch that, okay, even if it's the day before surgery, when we're going through everything once again, if we catch something and we feel that it's too risky for that patient, then we will not proceed with surgery. Okay, we will not proceed with surgery. We will not put your life at any unnecessary risk.
Thank you very, very much.
All right, everybody. So I hope we all got the lingo now. I know people are going to come to me and maybe like, Dr. Earl, I saw your thing, and I said, and I want the Soapy BBL with HD hips, upside down heart, and a Pokey Slope. And I'm going to be, all right, if you got the good foundation, and that's very reasonable, that's what we're going to do. Okay? All right. Well, this has been very fun. I hope to see everybody next week on Hump Day with Dr. Alex Earl. Ciao.